This afternoon at 5, there are just 13 intensive care beds available in the entire state of North Dakota. As officials say, hospitalizations are continuing to surge, and it's not just because of COVID-19. Valley News Team's Bailey Hurley spoke with doctors across the valley today on what this means for future emergency situations.
Of North Dakota's 13 available ICU beds, 10 of those are right here in the valley, 9 in Fargo and 1 in Grand Forks.
All it takes is for somebody come in from a motor vehicle accident or whatnot to fill those beds right back up. So it changes really literally hour to hour sometimes.
Of the around 150 patients currently in a North Dakota intensive care unit, only around 20% of those patients have an active COVID-19 infection, with a few more still battling the unfortunate side effects of the virus.
And they stay a pretty long time.
The rest of those in the ICU are there for the day-to-day issues, heart attacks, strokes, and those who put off their care during the peak of the pandemic and are now reaping the consequences.
We're having longer stays and people are not moving through.
And the tight bed space has forced all 3 hospitals to have to turn away patients at one point or another.
We like to say yes. At times we have been full where we have not been able to take a patient.
But all 3 hospitals say they're always prepared and have room for the unthinkable traumas that may have to come through their doors.
I'll hold some people in some other areas until, beds can clear up. We can even give ICU level of care in the emergency department needs. So we have a few things that we can do to manage.
You always want to hold a couple beds available because you never know when there's going to be a bus crash or anything like that. And we have to be able to serve the community right away.
Bailey Hurley, Valley News Live.
North Dakota continues to deal with a healthcare worker shortage as well. So far, both Altru and Sanford say it hasn't played a major role in impacting ICU bed capacity. All 3 providers say they urge North Dakotans to get vaccinated against COVID-19 to keep bed space open for the many other traumas and medical needs in the community. The person originally